on health. This series looks to be a tool specifically for faith leaders of any background looking to serve a variety of communities through either developing or sustaining already established health ministries. I am your facilitator, Reverend Krista Forbes, and this series is hosted by Our Health Ministry and was developed in partnership with the Morehouse School of Medicine's National COVID 19 Resiliency Network. Our health ministry is where faith, health, technology, and community intersect to provide trusted information, tools, and connections that support faith based organizations. I will look to have a conversation with different leaders who serve a variety of communities about their interest and or involvement in health ministries. And today, I will be joined in conversation with Mr. Nick Harris, the Executive Director of the Office of Community and Church Relations at Dillard University, a historical Black college and university in New Orleans, Louisiana. Greetings, Mr. Harris. How are you today?
Fine, how are you today? I'm very happy to be a part of it.
Well, thank you so much. I'm so glad to have you today. So, can you tell us a little bit about your role with the Office of Community and Church Relations there at Dillard?
Yes, the Office of Community and Church Relations was created after in response to Hurricane Katrina. It became a goal for Dillard University, not only to help the students to return to Dillard, but also to help repopulate the city of New Orleans.
Mhm.
So the office was created in order to help the city of New Orleans repopulate as far as housing, healthcare, and environmental services.
Wow, that was a hefty task that you all had before you, but I'm so glad that you all were able to get in place with that and continue with the great effort of serving New Orleans and the people and communities of New Orleans. So kudos to you and congratulations for that.
Thank you.
As part of our conversation today, I would like to ask you, when you're thinking of your role with faith organizations and your involvement and engagement with faith organizations there in New Orleans, how does this topic of health, because you have so many things, that you're conversing and engaging them with, but how does health get it addressed, particularly in communities of color? Do you find that those communities are hesitant to talk about health related topics?
No, they're not hesitant to talk about it. And how I really got involved is that, we all think we know the community in which we live.
Mm.
And I bring everything back to the foundation of rediscovery of New Orleans through Hurricane Katrina, because through Katrina, the curtains were pulled down and you were able to see what was going on in other neighborhoods. And with that, knowing that and realizing that, the first order of business in which we had at Dillard University is not to be a leader, but to be a listener, to find out exactly what services and what the needs of the residents were. And so with that, we wanted to use our resources in order to help. But it was very important for us not to be a leader, but in order to educate and demonstrate to residents how they can take control of their own community, and taking care of their community meant taking care of their health.
Mm. And I love lifting that up, not being a leader through listening. Oh, that is a wonderful reminder of how we should definitely move forward. Um, and when you think about approaching it that way, and it sounds like you all were really empowering those communities to take leadership in their own hands for the lack of better way of saying that. But when you are working with organizations, particularly faith organizations, what resources do you find to be most helpful to them in supporting their work in the community? And again, bringing those voices, those different voices together. How important is it for faith organizations to collaborate in that level, like in New Orleans? Are there a lot of collaborations taking place there?
Well, yes, there are a lot of collaborations taking place because prior to, and I'm sure it's in other communities too, we somewhat operate on a silo.
Mm.
A person may know that a church is located there, but folk with resources do not necessarily come out into the community. And so the first order of business was to invite these organizations, 501(c)s, different corporations, to come out to the community in these underserved communities where people actually lived and to see how their resources can benefit and help the residents. So with that, and I can tell you what happened is that I had a breakfast at Dillard University, invited several banks, insurance companies, and other large companies in the CBD, Central Business District, and from the different hotel managers to come out to Gentilly, where Dillard is located, so they can see firsthand where the folk that worked in their hotels
Mm.
actually lived and what resources they were without. And how could you partner with the community and share your resources, not only in your place of business in the CBD, but to bring those resources out into the community?
And I think about as I relate to or think about health, I think that's a wonderful model because there are so many health related organizations and just organizations in general, corporations that reach into the community but do it from a silo approach as you lifted, right? They kind of
Yes.
come in and then they go out. But if they go in and approach it from this is where your employees live, this is, they may work with you in one place, but this is where they live. This is where they grew up. And inviting them into that space, I think that's a wonderful approach to collaborations and to making some solid partnerships. Um, in the thinking about, and certainly New Orleans has had its share of, like you said, coming back from Katrina. You're there where you all are located. You get a lot of hurricanes passing through, unfortunately, your area. And then, of course, the past 2 years, you've had the impact, the horrific impact of COVID-19, like so many
Yes.
cities throughout the United States. When you think about the impact that COVID-19 had on communities, and particularly in communities servicing literally around the corner where Dillard University is located, what challenges have you seen among faith organizations or organizations that you work with in trying to negotiate and bounce back from COVID 19 or even negotiate through COVID 19? What has been some of the biggest challenges you've had to face there?
Well, actually, my challenges have not been great, only because I had already developed a foundation of building trust in the community and over a number of years. So I wasn't there just to get information and data from folk, but over the years, we brought resources to the people in the community as far as grants on how and building their homes and information on starting a business. So we invested and my office invested in the community, and it's an ongoing process that we've had. So when COVID came along, and the information as far as the partnering with community-based health centers, federally qualified health centers, and maybe hospitals or whatever, the trust was already there. And realizing that it was being spearheaded by Dillard University Community Relations, your name is out there very prominently and folk know you. And so therefore it wasn't a big challenge. And because we brought the information directly to their door, it wasn't as though the residents had to travel 4 or 5 miles to a location they were unfamiliar with, may not have had bus transportation, or parking may have been difficult, but we had it at different churches and we had it at Dillard University. So we had it in areas very familiar with them. And the ministers played a large role in that because that is the first order where folks go is to their minister when things are not actually going right. So rather than having it at a hospital where you go for your COVID vaccination, we had it at local churches and we also had it at Dillard University.
Wonderful. And again, you mentioned two key points because you had that established trust and you
Yes.
had those established relationships. When I think about the audience that may be viewing this and receiving this resource tool, and they're in different components of their ministry. They might be at churches, they might just be at nonprofits or some other organizations. What suggestions would you like to give as we close out? What suggestions would you give to help support their efforts in promoting health or health education and health awareness, and certainly in communications or in the community and in collaborations? Any last minute suggestions you would like to give?
Yes, well, the most important part is always be visible in your community, regardless of what it is. If events are going on that you may not sponsor, tell the people in your community about it. Invite folks into your community because most people think when they sit in their offices in the downtown area that everyone knows about them, or when they put a commercial on television, everyone knows they're there. Well, that is so very true because a face is very important. To identify with a face, a person, is something that we all need to do. So I would suggest to any minister and any faith-based group is to invite folk into your community and be very visible. Do outdoor events in the community. Work with your different partners, even closer to you, like supermarkets and whatever, donations for healthy foods and those different areas. Create community gardens, the things that would not cost a lot of money, but things that that will help people. And there's so many people at these different locations that have community-based individuals who would come out to the community and speak to them. But just continuously have activities without having to deplete your budget because actually it really doesn't cost any money to do it. And then in some cases like that, you'll be able to get a donation from these other larger organizations because they want to get out to tell more people about their services.
Yes, I love it. I love it. Think outside the box. Go outside of what you normally see, but reach further into the community of where you live. That was some really great information and insight, Mr. Harris. Thank you so very much for spending a little bit of time. I could talk to you all day
Yes.
about this because it's just so much going on and when we look into our communities. But I want to just again thank you for this conversation and all that you shared during our conversations with community leaders on this health series. And to learn more about this series and to sustain other information that could help sustain health ministries, we want to invite you and others to visit our health ministry website at www.ourhealthministry.com. So again, thanks to you and the wonderful folks there at Dillard University for all that you do. And thanks again to the Morehouse School of Medicine's National COVID-19 Resiliency Network, for they were able to really support our health ministry and allow this series to take place. Thank you so much, and you have a great day.